Well, National Cardiac Rehabilitation Week is this week, and joining us this morning with more details is Alan Lewis, the Director of the Cardiopulmonary Rehabilitation at CHI Memorial. Thanks for joining us.
Good morning.
This is a big deal that goes on, especially during February, but this week especially, you're going to all measures to make sure we know the importance of cardiac health and cardiac rehab. Have enough cardiac health, hopefully you won't need the rehab.
And the data makes decisions about how people are treated medically. The data is clear. One, only 20% that need cardiac rehab after bypass surgery, heart attack, a stent, heart failure, valve repair, replacement, or a heart transplant. Only 20% of the nation take advantage of a program that's been proven to reduce mortality. The death rate is lower. Their heart function improves. Their readmission rate is lower. It's been demonstrated over and over again, and still only 20% participate.
Why do you think that is?
It's complex. I mean, there's some folks that are older, they live alone, they're socially isolated. Some of it's in the referral process through the physician. Some of they don't understand that, oh, I had a stent. The doctor said my heart is okay, and I can go back to work in 2 weeks and go back to normal activity. They don't realize the disease process is still going on. They opened up an artery, they fixed that one artery, but the vessels are still being injured through either lifestyle or genetics, and they need help in understanding, how do I change this behavior? How to reduce the rate at which this artery is blocking up? Because you'll be back again. You know, one stent, another stent, eventually bypass surgery. Eventually you run out of options. And so teaching people how to change their lifestyle. I mean, I've worked with athletes that were really fit, but their eating habits weren't very good, or the way they managed stress wasn't very good. And so teaching them those things are specific to their needs.
Most people's ways of dealing with stress is self-destructive anyway.
Exactly. We crave high-fat food when we're stressed. We crave drugs and alcohol. Exercise has the same effect, but we can't exercise all day long. We have to learn how to deal with stress in different ways. But it's challenging when somebody gets the message that you're okay, go back to work. The psychosocial component is probably the most important part, is that you're now in a new club, a new fraternity or sorority. You have a heart problem, but everybody else around you doesn't. But when you get into rehab, you start working with people that they're just like you. They could be 10 years older, 10 years younger. The social support that occurs in rehab is very, very lifting up your confidence level up.
And you mentioned the social support. So what is the process of cardiac rehabilitation?
It has to be a physician referral.
Okay.
It can be a cardiologist, it can be internal medicine, any physician who manages patients who have a heart condition. It's standard across the United States, a referral. And then we check insurance, Medicare pays for it. For those diagnoses we mentioned, private insurance pays for it. Another barrier issue is the high copay. As we move in the cost of health care, we're shifting the cost to the patient. So their out-of-pocket expenses going up. So instead of all my sessions, 36 sessions, totally paid for, I might be paying $10, $20, $30. But you know what? If you do this program and it keeps you out of the hospital, you might spend $500, $600 in copays that would cost you $100,000 for another bypass surgery.
Sure.
We don't think long-term, we think tomorrow. I can't afford it tomorrow, I can't do it.
And that's part of what you guys do at the Cardiac Rehab Lab. You're training folks to look beyond tomorrow, further on down the road.
Exactly. So you are around to enjoy the jewelry that you're going to buy your spouse, or go to the Westin Hotel, whatever, to enjoy your life, to have the confidence that your heart is functioning well. And we have patients that have been on our program. After rehab, they can join a gym membership. I've got patients been there for 22 years.
Wow. And that confidence thing, I know a number of people who have had heart issues and they're so afraid to get back and live their life, they're holding themselves back and actually doing more and more damage than good.
Or either they don't do enough or they do too much. But there's also the psychosocial injury to the spouse, worried to death about their loved one. So we also provide a program for the spouse to come in and participate with the heart patient. So they both grow together through education, through exercise, through social interaction with other spouses. That's what's so important. And it's not a very expensive program, but the research is clear. In a 10-year study, readmission rate lower, death rate lower, and a measure of their heart function, which is how hard the muscle can contract, is called ejection fraction, it actually goes up. There's no medicine that does that.
So the stats are definitely behind our rehabilitation program.
Definitely.
And you know, one thing I think it's important to remember, your heart did not get diseased overnight. You're not going to rehab it overnight either.
That's a good point, because it starts at birth. So the habits you have, even if you have genetic traits, the lifestyle explains about 80%, all the risk factors, 20% is genetics. So if you have great risk factors based on lifestyle, but your genetics are poor, there are medicines to help with those genetic risk factors. So that's where it's important to learn, what do I need to do? You know, I don't put sugar in the gas tank in my car, right? I have my car checked regularly once a year. We take better care of our car than we do our hearts.
Wow.
It's a good way to put that.
Sobering place to leave it. Alan, we're out of time. We hope you'll come back here a little bit later on into the month and give us an update on how many folks you have that are taking care of the great services. y'all
Love to do
offer
it.
down
Love to
there.
do it. Great show. Thank you for
If you want to get
inviting
in touch with Alan, you can do so. It's easily done. Check it out at the CHI Memorial Cardiopulmonary Rehabilitation Center, Memorial Hospital downtown, 495-7764. Hang in there. We have more of Let's Chat right after this.